And finally, we can provide feedback. You can help students throughout the day by providing them with positive, specific, and frequent feedback, as well as continuing to ask probing questions to assist them with their thinking through the aspects of care. At midterm, we will be giving the student a formative evaluation offering a specific plan for their continued growth, and then a final summative evaluation at the end of the rotation. And I'll talk more about the evaluation in the student evaluation module. I'd like to share a few tools in this presentation to help you think about the strategies that you could utilize as you work with students. And for more, check out the clinical toolbox. Students are taught to use the nursing process as a means to assess their patients. And we know the steps of ADPI: assessment, diagnosis, planning, intervention, and finally evaluation. And there has to be more, though, to each clinical day. We as nurses do more. I have included a couple of tools in both the clinical toolbox and here in this module for your consideration. These tools can help both you, the instructor, and the student to go beyond ADPI. Using this clinical reasoning reflective tool that uses the acronym of SAFETY can help students go beyond the individual patient assessment and interventions. The tool has the student consider additional components of patient care, such as the appropriateness of their room assignment, daily priorities, infection control, and ethical and legal issues of HIPAA and scope of practice considerations of the nurse. This tool can help the students look at the bigger picture of patient care. This article by Russell and her collaborators includes a grading rubric to help you assess the student's proficiency with clinical reasoning. I recommend reading this article, and perhaps you can use it as is or modify the tool and the rubric for your particular clinical rotation. Reflection can help students to both expand and develop their clinical knowledge and reasoning. Clinical reflection in nursing is gained through discussion, as in post-conferences, and through journaling. A journaling assignment can be free-flowing about the student's day with or without a specific objective. I created a very basic tool for reflection, which you can find in the clinical toolbox. The tool has basic open-ended questions. Christine Tanner developed a model for clinical judgment using reflective practice to help students connect nursing actions to outcomes. Nielsen and her collaborators developed a guide for Tanner's model to help students focus their reflections. Then Kathy Lassiter developed a grading rubric for the assignment. So between these three articles, you're left with an evidence-based reflective student assignment. In this method, students use reflective practice as a teaching-learning strategy. So I encourage you strongly to review these three articles and consider using some aspect of this assignment. But what about you? What tool can you use to work with students to bring it all together? Here's a teaching formula for you using adult learning theory, constructivism, and reflective practice in 5 easy steps, and it's called the 1-minute Preceptor. This tool uses questions, feedback, and reflection. In her article, Curtis points out learning in the clinical setting is a complex phenomenon. This tool packs all the learning frameworks together in an easy-to-use strategy. The strategy helps a student work through their decision-making and clinical reasoning, and it gives you a formula. In step 1, you ask the students to give you their assessment. The student explains the patient's condition or the results of their assessment. Step 2, you offer scaffolding questions to elicit the student's rationale for their assessment conclusion. Then in step 3, which they call teaching general rules, you would help the student connect the dots about their assessment rationale. If the student is able to give all the correct information, this step is unnecessary. Step 4 is where you will reinforce everything that the student did correctly, even if they made some errors. You start with what was done correctly so that they know how and what they should be doing correct the next time. Then, making sure you correct any mistakes, that would be your last step, step 5. An important takeaway in this process is to remember to be specific in your feedback. If the student is really struggling, it might be time for a private conversation, and you might decide it's time for the student to return to the skills lab for remediation or to be placed on an improvement contract, but more about this in the evaluation modules. Take a look at the brief demonstration of the 1-minute Preceptor tool in this short, funny video clip that was created by a nursing instructor.